Good evening, welcome to Central News. I'm Hilary Entwistle. Katikati residents will soon see the first visible improvements to their town centre, which they're contributing to via Western Bay of Plenty District Council's targeted rating. The first two areas set to receive a rejuvenated appearance will be the front of the Katikati Memorial Hall and the soon-to-be vacant fire station building on Main Street. Now for our region's weather, Hamilton, your Tuesday will have rain easing to showers in the morning with a southwest change. Your expected high is 18 and an overnight low of 7. Tauranga, you will have rain clearing and then fine in the afternoon with a westerly change. Your expected high is 18 and an overnight low of 8. Just ahead, not so superannuation. Welcome to Central News on TV Central. A group of Waikato University students have just come to the end of their public relation campaign, Not So Superannuation. The campaign questions why New Zealanders are not sustainable with their money, whilst raising awareness about what to expect come retirement. Harriet caught up with some of the team to find out more.
So what sparked the idea for this Not So Superannuation campaign?
We did a lot of background research on poverty in general, and we really found that elderly poverty was something that was overlooked, and so we went into researching more about elderly poverty and found that statistics showed 1 in 5 elderly in New Zealand were living below the international poverty threshold, and also our population was ageing, and so we just thought that was an issue that really needed to be addressed.
And why do you believe that retirement is for so many people not the relaxing time that they expect it will be?
I think that people tend to believe that living off the superannuation will be enough to live a comfortable retirement lifestyle, but in reality they do need to save to make sure that it is what they want it to be.
Do many New Zealanders struggle on the pension?
Yeah, we've had a lot of feedback throughout our campaign as to some of the hardships people face during retirement, and there is a significant drop from an average weekly wage of around $800 a week for an average New Zealander to the $300 average for a single person living alone. And I think the main issue here is that the cost of living is rising, and the superannuation isn't actually keeping up. So it is quite difficult for people to survive, especially if they don't have assets. That's one of the main things we've found out, is that if people own a home, it provides a bit of a buffer for elderly poverty. But if they don't own a home or assets, then yeah, they really do struggle to cover that rent and living costs.
And what were you hoping that this campaign would achieve?
We were really hoping to get a discussion going between elderly and the sandwich generation and really highlight what struggles have already been faced and sort of provide information to the sandwich generation of how they can be more financially self-sufficient and save for their retirement so they can live comfortably.
And now that it is finished, what do you think that the influence has been, or what sort of feedback have you received about the work that you've been doing?
I think we've had a really strong impact on members of the public. We went and handed posters and flyers out, and then in regards to our online blog and Facebook page, we've had a lot of feedback, especially from elderly people. We've also had feedback from people who work in the health sector, as well as sandwich generation people who are currently saving or want to start saving. So I think that we've had a lot of engagement between the two generations, so it's been really good.
How did you get the public involved with what you were doing?
So our campaign message was actually not so superannuation. So that was a question that we posed to the public, which challenged the luxurious kind of stereotype around retirement and really caused people to think about what their future was going to be like if they didn't save. We used, as Erica mentioned, Facebook, which we had over 1,000 likes in 2 weeks, which was amazing, and our website. Our website was great because people were able to comment anonymously, and we had so much engagement through there. It was fantastic, and we've actually found it's been a really an overlooked issue, and people are actually relieved that there is a campaign about this at the moment. It's a very kind of in the news topic, and so we didn't actually need to work terribly hard to get a lot of engagement. We've had so many messages of support for the campaign, and people are really excited that somebody's finally doing something about this, so that was fantastic. Also, as Erica mentioned, putting posters up, and also we had a number of large organisations who are some of Waikato's largest employers, Waikato DHB, Waikato University and Opus, circulate some information on their internal intranets, which really got our reach up there. So yeah, it's been great.
At what stage do you think people need to start preparing for their retirement, and what are some ways that they can do that?
I think through our campaign we've found as soon as possible is really important to start saving, even if it's a little bit a week, subsidising a coffee a week and putting that money away. And it's also really important to try and invest and get a house, because those are large costs when you go into retirement. And just go and talk to your bank about and get advice for saving for your retirement.
And what have you gained personally from being involved with this campaign?
Along with what both Nicola and Erica have said, just the practical side has been amazing. Like, it's given us something that we can go and talk about in job interviews, of something that we've actually implemented. And as well, like with Nikki, I was elected deputy leader, and so just learning how to manage 15 people and overcome those challenges has been awesome.
Personally, being involved with this campaign has allowed me to learn so much more practical work. Learning all this theory and then putting it into action has been really good, and getting out in the community and working with people and proper professionals, and it's just been really, really good.
Throughout the campaign there have been so many learning opportunities. I guess exactly the same as Erica said, it's a practical component, and it's sort of supposed to be our last big thing before we enter the world, so it gives us a really good practical side there. I was elected as sort of group leader, and there's actually a group of 15 of us behind working in the back scenes, I guess. So that's been a real big learning experience for me, is managing all those people, and I've enjoyed it so much. We've been a great group, but yeah, that's been really awesome. The Not So Superannuation campaign was a public relations campaign which encouraged New Zealanders to take control of their own retirement and start saving now, also intending to develop a sense of financial self-sufficiency into the New Zealand culture in terms of retirement.
To find out more about preparing for your retirement, there are several websites you can visit. Go to notsosuperannuation.com to find all the information you need. Just ahead, health literacy awareness. This month marks the start of Health Literacy Month in New Zealand, a month where people can be better educated about making healthy decisions and be more informed about using health resources effectively. Sue Reid from Workbase is an expert on matters of health literacy, and Harriet caught up with her to find out what this month is all about.
So what does it mean to have health literacy?
Okay, so health literacy is quite a new concept in New Zealand since sort of 2008, 2009, and it's a concept that's come from the States, and there are a range of definitions about it, but the most common definition, the most commonly used definition, is actually the one that's used in the New Zealand Research Report, and it says good health literacy means people are able to obtain, process and understand information and then make informed health decisions. So sitting behind that, obtain, process and understand and make informed decisions, is who's responsible for helping people obtain, who's responsible for helping people process and understand the information, and who's responsible for then helping them make informed decisions. So on the face of it, the definition looks like it's all about the patients and their families, but actually behind it there's quite a lot about what health professionals need to do, and also what healthcare providers and healthcare organisations need to do as well. So yeah, it's quite interesting because it often sort of looks like it's all about the patient, but it's about everyone in the system helping to make sure people understand what they need to do or have to do.
What are the statistics like in New Zealand when it comes to health literacy?
I think most people are very surprised because the Ministry of Health took some data that was available out of a 2006 OECD survey, And the data showed that 56% of adult New Zealanders, more than 1.6 million, had low health literacy. That's not a surprise to us, because low health literacy is because most people find health information as both complex and unfamiliar. So it's not the sort of thing we read about in the newspaper every day. You know, if you go to see a doctor and they diagnose you with something, that's uncommon. You know, it's not the sort of thing. I'm not talking about the flu or something that you go to the pharmacist about. I'm talking about going and being diagnosed with something. So in that group, 1.6 million, the largest population are in fact Pākehā New Zealanders. Largest population have low health literacy. There are significant issues for Māori and Pacific people, and also for people who obviously don't speak English as a first language, because that makes it more difficult to obtain the information and process and understand it. But a lot of people think it is actually about what I call a brown problem, but it's actually a problem for all New Zealanders. And then over above that 1.6 million, every time someone in your family or you are diagnosed with a new condition, you will have low health literacy for a temporary period of time. So say you're diagnosed with, well, actually the most common example for me is I talk to mothers of children who've been diagnosed with leukemia, and the mothers will say for a very small period of time they know nothing about leukemia except it's not good. And then because they're highly motivated to learn because it's their child, they grow their health literacy very quickly, because it's about this child, I'm motivated to care, that's my child, I want them to live. So everybody in New Zealand at some stage will suffer from low health literacy, because they'll be diagnosed with something that's new or unfamiliar to them or someone in their family.
How do we here in New Zealand compare when it comes to health literacy in the rest of the world?
We're about the same. So the OECD survey that was done in 2006 was also done in Australia, Canada, the US, also Scandinavian countries. It wasn't done in the UK, but they've since done a sort of similar survey. And basically we're the same as Canada and Australia. Australia's slightly worse than us, but so we're about the same as the US. So again, more than 50%, between 50 and 60% have low health literacy. Scandinavian countries, better health literacy than others. Probably because they have there's a lot of research trying to work out why that is, but they have a different education system, a differently funded education system, and a differently funded health system. So they think there's a link between that. But it's the same for literacy, not just health literacy. The Scandinavian countries are better than us.
What sort of health literacy projects and programs have you personally been involved with that you believe have been the most standout when it comes to seeing results?
This one I was talking about earlier, the one around health literate organisations, I think that's going to make a difference. But I think they all do to help in the puzzle. So some work with the patients and families, and some work with health professionals, and others work with the organisations. So I suppose my absolute favourite, and everyone says I'm mad to talk about this, is I've done some work around gout, because it's quite an important issue, particularly for Māori and Pacific in New Zealand. But yeah, there's a whole range of things we've done, and all of them at the time are really interesting and useful, but I think it's trying to make sure that you always address, if you're working with patients and families, you always address what health professionals are doing and what the system is doing, and vice versa. If you're working with the system, what are patients doing as well?
So what do you hope that Health Literacy Awareness Month will achieve?
It's all about what it says. It's about building awareness of health literacy, which is a really important thing for people in the health system and for patients and families to understand how they can build their knowledge and understanding.
Workbase have referenced a list of credible health literacy resources on their website. To find these or find out more about Workbase, visit healthliteracy.org.nz. Coming up next, Breast Cancer Awareness Month. If you have just joined us, welcome to Central News. October is Breast Cancer Awareness Month, and Tauranga Breast Cancer Support Services have been busy with many events already over and done. I caught up with Leah to find out what they have been up to so far.
Apart from dyeing my hair pink so that everyone else realises that it's Breast Cancer Awareness Month, we've got several events that we organise leading up to October, where everyone dresses in pink, obviously, and that helps raise awareness of the breast cancer cause. Also helps women celebrate survivorship, helps families to remember those that maybe we've lost, and hopefully inspire others to remember to be breast aware and to get anything checked immediately. So yeah, we've been keeping pretty busy.
Tell us about the Hot Pink Walk coming up on Wednesday.
That is our biggest event. It's now in its 11th year, so it's been a big one for us for a long time. This year we have a new sponsor, House of Travel, hence HOT, House of Travel for Hot Pink Walk. So it was a beautiful fit for us. The name just worked really well. So we're really pleased to have them on board. We have seen around 3,000 to 4,000 people in the past for this event, so we're hoping to replicate that again this year. It runs through downtown Tauranga, and we go on about a 2.8 kilometre walk around the streets there, and just really celebrate. There's a bit of entertainment as you go. It's $5 to enter, that you can do at House of Travel. And then you also go on the draw to win $500 travel vouchers too. So if you do that, early bird. So if you do it by Tuesday the 15th for the walk on the 16th. So yeah, it's a lot of fun. Everyone gets into the spirit of things. It's absolutely fantastic.
So it's kind of like a sea of pink on the Strand?
Absolutely. Men, women and children, everyone dresses in pink, and it's an absolute fun time. I think every year I'm amazed at the amount of costumes and variety of costumes that come out. It's just awesome.
And what's happening on Wednesday the 23rd of October?
That's another big one for us. We have More FM run an art edition calendar for us, where they have collected artwork from local artists and donated that to us to put onto a calendar. And then they auction off that artwork. So the auction is on the 23rd down at the cargo shed downtown. Entry by gold coin donation, a few drinks and nibbles of course, wouldn't be right for More FM not to provide those. And they auction off the artwork, and hopefully everyone gets a piece of nice art that they then remember us by, and we get some great fun. So that's a really good one. Also on that day, our Encore program starts, which is a national program run for breast cancer survivors or women. They get into the pool and do a lot of exercises in the pool. There's also ground floor exercises, as well as relaxation meditation techniques. And yeah, they just learn a bit more about how they can look after themselves and keep those arms moving after surgery. So that's starting that week as well.
Now, you recently had a t-shirt competition. Tell us about the winning design.
It is a lovely bird designed by a local designer, Donna McTavish. And well, she wasn't so much a designer, she just decided to enter and gave us the lovely design. It's a bird in flight, and she did that. Her mother had breast cancer, and she's done that bird to represent the woman on her cancer journey and the journey that she takes. And then on the wings she's written in a whole lot of words of love and inspiration, and those are the supportive words that fly with the bird. So very much keeping that bird flying and up and happy and so forth, which was really lovely. So it's really resonated well with people this year, and the wings are a bit sparkly, a bit of bling on there, which always goes down well. So we're actually quite close to being sold out again this year, even though we've got more t-shirts than last year. So it's great.
How common is breast cancer?
Quite common. You know, there's a few people out there still that don't know someone that's been through the experience, but a lot of people I talk to do know someone, whether it's family, friends, themselves. When you hear there's 7 women every day across New Zealand that are diagnosed, it really makes it quite clear how common it can be. It's good in some ways in that there's always someone to talk to that's probably been there, done that, but obviously it's quite a scary statistic. So,
do we know what causes breast cancer yet?
No, short answer. You know, research has come a long way, and they're looking at all sorts of things. And there's different schools of thought on different areas that this may be the cause and this may contribute. There's a lot of things that may increase or decrease the likelihood, but to be able to say that this has definitely caused breast cancer, no, we're still a ways from figuring that one out.
How does Breast Cancer Support Services Tauranga help support women who have had a recent diagnosis?
Well, what we do here, we've been going for 22 years, and we started because some woman noticed that there wasn't that supportive network. The doctors and the nurses and everything are just fantastic, and they do a great job, but it's very much from a medical side, and they felt that what was lacking was that emotional support. So they started by getting survivors together and putting them in touch with each other to be buddy support, really. So that's what we do, that's the heart of our service. So we receive referrals from the hospital of ladies that have accepted our support. I give them a call and just figure out who they are a little bit, and then put them in touch with someone who I think will work well with them, who's also a survivor. And they're at least 5 years down the track normally. We have 2 to 5 years, some we actually have 50 years down the track, which is quite inspirational for newly diagnosed people to see that you can go that long. It's not a death sentence, you know, people survive breast cancer. So that's at the heart of our service. We also have free counselling. We have group support, so we have a lot of group meetings here at the office, and well, it's not so much an office as a nice home, welcoming, come and have a cup of tea kind of home. So it's about getting people in touch with each other.
What support do you offer when patients are going through treatment?
Well, if they've accepted a support visitor, that person will be calling them regularly after appointments and so forth and talking through the issues, and they're likely to have been through the similar treatments, so they can really connect and relate and understand, which is different from family and friends because they haven't actually been through it. So that's the key. So they're often making those calls. We definitely take any calls if someone needs help getting to and from appointments, if someone needs help, you know, with cooking and cleaning because they're just too tired and that kind of thing. So we're here to offer any of those kind of things, as well as just being a listening ear and somewhere to come and talk where cancer won't cause that lull in a conversation.
So what is the key message for everyone about breast cancer and early detection?
The key message definitely is get familiar with your breasts. You know, in the shower, have a feel, any lumps and bumps, do something about it, go and get them checked. Look in the mirror too, because it's not just lumps and bumps. If there's any changes to the skin, to the nipple, any dimpling, definitely get it checked. It could be cancer, it may not, but it's worth knowing. So just get familiar, any changes, get them checked.
If you or anyone you know is in need of any support with a breast cancer diagnosis, you can view the support services details on breastcancerbop.org.nz. That is the news for today. We really want you to be involved, so like us on Facebook and let us know your views. If you have news including your own video and photos, go to our website and hit upload. Thanks for joining us. I will be back tomorrow night with more guests from in and around the regions. I'm Hilary Entwistle. Have a lovely evening.
This has been an Alpha Media production, a division of Television Media Group.
Supporting local content so you can see more of New Zealand on air.